Good evening. Thanks for joining us. We begin tonight with a message from local health officials who say they've been caught off guard by the early flu season. The latest health unit numbers show local cases 10 times higher than they were at this time last year. Sean Irvin reports.
At this newly opened independent pharmacy, customers are said to be looking for anything they can find to ease flu symptoms.
What is it that they come in with?
Runny nose, headaches, feeling very out of it. They're just very tired. They don't want to get out of bed.
It's a trend impacting on doctors' offices, walk-in clinics, and local healthcare facilities. In London, a level 2 outbreak is in effect for a portion of Victoria Hospital.
I think the influenza activity we're seeing this year is taking place earlier than it is most years, and that is what is surprising most folks.
With over 1,000 cases reported in the second half of 2025, the Middlesex-London Health Unit is urging the public to take precautions, even as cases fell slightly in the most recent week recorded. The risk of person-to-person transmissions at holiday gatherings was not fully factored into those numbers.
It's important to stay vigilant now, and particularly with the increased cases of influenza. And so for individuals who have not yet received their influenza vaccines, it is strongly recommended that they do get that vaccine.
Dr. Lamb acknowledges this year's version of the vaccine, produced based on last year's flu strains, does not protect against all subvariants. But he and other health experts strongly repeat that it is the best option to protect yourself. Most seniors and parents with children are eager to roll up their sleeves.
It's a tougher sell in the younger crowd, but once you explain to them the benefits versus the risk, they're willing to take it.
15 people in London have died from the flu in the last 4 months. That's compared to 0 during the same period in 2024. Again, the early arrival of the virus is to blame. But that does not necessarily mean it is about to disappear early.
And we're expecting the number of cases to continue to be elevated in January.
Well, flu season runs until April, so even if it's the highest peak now because of family gatherings, it still could happen later on. It's better to be protected for the entire season.
In London, Sean Irvin, CTV News.